A lot of news from the FDA on e-cigarettes and tobacco. And look who we have with us today. Alex Azar, Secretary of Health and Human Services. Mr. Secretary, welcome back to the show. Good to see you, sir.
Good to see you, Stuart. Thank you.
What's this about a ban on menthol cigarettes? Explain.
Well, so menthol cigarettes, the menthol flavoring in tobacco is really a very attractive and addictive property for especially kids. You know, the majority of kids who start combustible smoking, they do so with menthol-flavored tobacco. And then when we look at adults, a third of adults use menthol-flavored cigarettes. And it has a disproportionate impact on the underserved. And this is a community that already is suffering from great health disparities. So we've been running a public process. We've heard these public health concerns. And we're going to be initiating a process to look at banning menthol flavoring of tobacco. This will be a public, open, transparent process. It will take time. We'll consider all public health factors. It will be very thoughtful.
This is somewhat similar to your attempts to crack down on flavored e-cigarettes. But I believe, Mr. Secretary, you've got some numbers on teen usage of these products. Tell me more.
We do. Just today, the FDA and the Centers for Disease Control and Prevention released data that is frankly shocking. We have an epidemic of e-cigarette use happening among our children. Among current high school kids, there has been a 78% increase in e-cigarette utilization in the last year. And Stuart, among middle school kids, a 48% increase in the use of e-cigarettes. And I have seen this as the father of high school kids. I have seen this personally in my own life. Not of my kids, thank God, but I've seen it in their friends with using of these e-cigarettes. They're very attractive, they're very available, and we're not going to let that happen.
Now, I understand you want to crack down. I got that. But e-cigarettes will still be available in stores. As I understand it, how does that stop minors from getting hold of them?
Yeah, so the important thing is we want to make sure that e-cigarettes are not available or attractive for our youth. E-cigarettes can serve an important purpose. They can be there for adults who are trying to transition off of combustible tobacco and to move to an alternative nicotine delivery device. And that's a good public health service off-ramp for combustible tobacco. But we can't let these e-cigarettes become an on-ramp to nicotine addiction or combustible tobacco use by our kids. So we're going to be, what we want to see is these flavored units, these flavored nicotine delivery devices. They would be available in settings where kids can't get them. So parts of stores or stores where you have to be 18 or over even to get in them, or online where you have sophisticated age verification procedures to ensure that kids are not getting access to them.
Got it. Mr. Secretary, you declared a public health emergency in California because of the wildfires. Is this all about toxic smoke?
That's part of it, but it's also about access to health care services. It's about disruption to the state and local governments in their interactions with our federal health care programs. So the president spoke with Governor Brown and assured them the full support of the federal government. And combined with a federal emergency declaration, I declared a public health emergency. And we stand by ready to help with public health officials, with disaster emergency medical teams who can provide help, diagnostics, as well as help for individuals exposed to smoke, as well as caring for individuals who are displaced for their homes, as well as providing support for medical facilities and evacuation of patients, just like we do in any hurricane or other public health emergency setting.
I wish all of our guests were as direct and answer the questions as directly as you do, sir. You're a very welcome guest on the program. Thank you very much for being here, sir. Appreciate it.
Thank you, Stuart.